your baby's delicate, and you want to give your baby a great start. So let's talk about care for your baby, all the way from conception to birth. The health of the mother and the father is a prime player in the health of a child, and that's why the true beginning of child care in Ayurveda comes at preconception. Before conception, Ayurveda recommends cleansing, and then also tonics to strengthen your body. It recommends a nourishing Ayurvedic diet, and also beginning a spiritual practice 6 months at least before conception. And of course, we have a lot of information about this in our pregnancy lectures on our YouTube channel. Following conception and care during pregnancy, the way a baby is born can also affect the baby's health, whether the mother has used antibiotics, whether the delivery was through a C-section, whether there was delayed cord clamping, etc. There's lots of factors that go into the care of the child from conception to pregnancy and then in the delivery room. And of course, we can't get too perfectionist about it either. No parent is perfect and no birth is perfect. If your baby must go to the NICU, that may cause a stress response similar to a traumatic event in your baby. As with adults, however, babies respond differently to trauma. And so just watch your baby and try to respond appropriately or make the appropriate changes to accommodate whatever the situation is. As I mentioned, birth is never perfect, but somehow we all find ways of coping and dealing with it. Consider the delivery environment where the baby is born, whether hospital or home. A lot of people have a misconception that home birth is more dangerous than hospital birth. But actually, home birth is the norm in several developing countries, including the Netherlands. And outcomes are not that much different from hospital births. In addition, a home birth gives you complete control over the environment of the birth. Whereas in a hospital, you may have less control over the environment. Now, hospitals do offer some advantages as well. For one, somebody else is taking care of everything, and that may ease the burden on the parents. But in a hospital, there can be bright lights, lots of noise. In either environment, hospital or home, you can end up entertaining a crowd of people soon after the birth or even during the birth. And so, take note of what kind of environment you want to give birth in. Consider the attitude and peacefulness of all care providers and everyone assisting in the room. When the baby's born, the baby may be born with Vernix, which is a white, creamy, almost cheese-like coating on the skin of the newborn. And this Vernix is important. It helps the baby's skin adapt to life outside the womb. Think of it. Your baby's been in a watery sac for its entire life, and now it's in the dry atmosphere. So this Vernix is a kind of oily substance that helps with that transition. This Vernix helps retain moisture, and it supports regulation of body temperature and also has an immune function. The fact that this kind of oily substance, the baby's born with this oily substance, is perhaps one of the best justifications for the Ayurveda practice of Abhyanga, which is oil massage, and that's commonly given to babies in India, probably for much these same reasons. Avoid cleaning off the Vernix for 1 to 2 weeks, and even avoid bathing a baby until the cord falls off their belly button. And that way that Vernix can continue to protect them. I'll just make a note here that I don't use soap on my babies until after they're 1 year old or more, and even then we use soap sparingly, even as adults. There may be some areas of the body that need a little soap, but generally rinsing off the body and rubbing it with a towel is often sufficient. I'll use a shampoo But I try not to strip all the oils off of my skin by using soap or to destroy the microbiome of the skin. Anyway, our youngest baby, little John, he's 3 months old, and he has a lot more kapha than my other kids. His skin is much oilier, and he sweats more. So we'll probably use some soap on him earlier. It always, all these things are dependent on the individual and constitution. Antibacterial soaps especially may inhibit the development of the baby's microbiome. Hold your new baby as much as possible. Skin-to-skin contact is ideal to ground vata for both mom and baby, which is naturally vitiated in the birthing process. The skin-to-skin facilitates bonding, which has a big impact on the baby's health and well-being in the future. And the skin-to-skin can even help the baby's immunity. It releases oxytocin, which is the love hormone or the bonding hormone between mother and baby. We recommend immediate latch and breastfeeding because that's also important for bonding. Breastfeeding at least should start within the first hour of birth via skin-to-skin contact. We would recommend breastfeeding immediately, but at least within the first hour because that's going to affect the amount of milk your body will produce. Research shows that nursing within an hour of birth does affect the amount you produce in the following days. So, but best is immediate because that's what increases the bonding the most. A little bit about colostrum. Colostrum is a nutrient-rich substance that's produced by all female mammals right after birth. And it's like the normal milk, but much richer. It contains a lot of immune factors and also growth and tissue repair factors. So it's really important that your baby gets your colostrum. Colostrum is a laxative that clears out the baby's gastrointestinal tract of meconium. Now, meconium is a kind of poop-like substance. It's really more like a tar that's in the baby's GI tract during the entire gestation period, pregnancy period. Anyway, the mother only makes colostrum for a short time, so it's important that you breastfeed your baby at least for the first 4 days, even if you don't plan on breastfeeding afterwards. Then nurse 8 to 12 times or more on day 2 and throughout the next few days to stimulate milk production, help the baby gain any weight lost after birth. And research shows that what you do in the first 24 hours or the first month even sets the stage for successful breastfeeding. So it's important that you get a good start. But, first-time moms may have a little trouble with breastfeeding, etc. Try not to stress out about it. Get a lactation consultant and do the best you can. With my first... that was one of those that was an issue, but then you figure it out and it goes smoothly after that. Breastfeeding can also prevent newborn jaundice. Temperature. Babies can't regulate their temperature very easily, so make sure that the baby's in a warm space but not too hot either, because babies can't sweat, and skin-to-skin contact does help keep their temperature stable. Clothing for the child. Swaddling the child may make the baby feel more comfortable and like they're in the womb. About half of my babies loved swaddling and half of them hated it. Some babies really like the motion and freedom, and so check to see what your baby likes. Yeah. When you're wrapping the baby or putting them in baby carriers, etc., think about what their posture is like and how their legs are like, and whether that can cause potential hip problems. Just look up, especially in baby carriers. Just look up how that posture that the baby's going to have it may affect their hips. Lots of babies get jaundice in the first few weeks. I had it. 3 of my kids too. It's extremely common. And 10 minutes exposure to the sun, direct sunlight, several times a day was recommended by our midwives for jaundice. It's not life-threatening, but in rare cases it actually is life-threatening because and sometimes it's due to biliary obstruction. But that's rare. When I mentioned that, jaundice is very common, and it's extremely rare for it to be due to biliary obstruction. But if it is due to that, it is life-threatening. Generally, when you're caring for a newborn baby, if the baby's sick or the baby has an imbalance, etc., you treat the mom to treat the baby. You give the mom the herb, and then through the breast milk, the baby gets it.